Lakeland Currents, your public affairs program for North Central Minnesota. Closed captioning is made possible by Bemidji Regional Airport, serving the region with daily flights to Minneapolis-St. Paul International Airport. More information available at bemidjiairport.org.
Welcome to Lakeland Currents. I'm your host, Todd Haugen. Our show is about Oshki Manidoo in Bemidji. We have the CEO with us. His name is Jeremy Syverson. And also from Oshki Manidoo, the outpatient manager. Her name is Juanita Reopelle. Welcome to Lakeland Currents to you both.
Thank you for having us.
Oshki Manidoo is something that people might have heard the name locally and may not be aware of what it is. What is Oshki Manidoo?
So Oshki Manidoo is, it stands for New Spirit Center. So a lot of people recognize it as the old Gilfillan Center in town, and White Earth Nation purchased the land and property back in, I believe, 2007, with the idea of going forward and having it continue with our youth inpatient residential program on there. So we operated that program for, I think it was until 2012, 2013, around that area is when we expanded and brought our inpatient residential women's program. It's called the Women's Wellbriety Program. So currently we operate 2 residential facilities, one for male and female adolescents, as well as our adult female residential for women. One thing that really makes us unique across the state is that we are able to have women bring their children with them to treatment. Mm-hmm. So we have our 2 residential programs. And then I think around 2016, 2017, we kind of expanded. We wanted to keep that continuum of care and open outpatient. We're having individuals who would come to residential treatment. They would graduate and they wanted to continue to work with our program. They wanted to stay in the community. And so we expanded to add outpatient treatment on there. We've had some individuals with us for years that continue to seek services and have that relationship with us. Along that time too, when there started to be more of an uptick with heroin, opiate abuse. We've had an opiate epidemic for many years. Indian country is generally hit pretty hard with that as well. So we expanded, met with some partners, and kind of piggybacking off of one of the programs that White Earth started on the reservation over there, the MOMS program. It was maternal outreach and mitigation services. They started to offer buprenorphine treatment for opiates for pregnant women. So they started off of that, and being that we service a lot of females who are pregnant themselves, have children, we began to explore offering that within our treatment setting too, in an outpatient setting. So
Jeremy, you said Oshki belongs to the White Earth Nation, White Earth Tribe.
Yes.
But is anybody eligible to come there for services?
So we are open to everyone. We do, probably 99% of our individuals we serve, our relatives that we serve, we call them, are of Native American or have ties to Native American communities. We are culturally based treatment services, but once again, we've had individuals who are non-Native American, but they have close ties to the community. But we're generally open to everyone.
And you said when the facility was purchased by White Earth, the facility and the land, and I was reading about it online, there's more land there than I thought. How much land do you have there?
Yeah, so we do have 40 acres.
Wow.
Right in the middle of town. Yeah, it's kind of, a lot bigger than you'd think. You kind of see the buildings there, but it expands pretty good.
Right.
We have some trails in the back. Have some wood. We have wildlife. We have a pond. So it's a nice, almost wildlife setting within our urban, area.
Pretty convenient.
Yeah.
And beautiful.
And beautiful.
It is.
Juanita, what do you do as manager of outpatient services? Is that it?
Yes, that's what it is. So within our outpatient services, we, as Jeremy mentioned, we have the opioid treatment. So people come and engage in getting medication for opioid use disorder. But we also have a program where you don't have to be an opioid user. You can just have a substance use disorder and still engage in outpatient programming. So my role is to focus on the direction of the program, and ensure that we are meeting our mission by helping individuals recover or on their recovery journey. And I supervise the clinical staff, meaning our counselors, treatment coordinators, and some additional staff that aren't considered medical staff.
About how many people do you serve generally, outpatient?
Right now we have about 120
Wow.
in our program.
That seems like a lot.
Yes, and we're open for more.
Really?
Yes, we're positioned to serve additional individuals who could benefit from outpatient services. A lot of our individuals who come, we have some that come on a daily basis to engage in outpatient services. Some for medication, some for groups and one-to-ones with addiction counselors, and some for both. And the ones that keep coming back are ones that seem to be benefiting from the community that's created there.
Is it generally people that many of us would consider young people, people under 25, or are there older people?
That's an excellent question, and we serve everybody. You walk in the door, you may see someone, a fresh 18-year-old, and you may see a seasoned 65-year-old, all seeking services. So we run the gamut.
I think that some people might have the misconception that this is a problem that just young people experience.
And so I'm thankful that you're bringing it out, because that is absolutely a myth. Addiction has no favorites. Anyone can fall prey. And so we're just here to support.
So what kind of, it's drug addiction counseling that you do? That's your primary mission?
Yes.
Okay. Yes. And do you provide any other kinds of services, health services for people?
So that is an area we are looking to kind of expand in. It's kind of one of those things that when you have an individual come in, there's a lot of issues that are, whether they would be the primary issue that leads, it's always been the one thing, what leads to addiction, kind of like the chicken before the egg, is it a mental health issue? Is there trauma? So there's a lot of things, that affect that individual. We do have the ability to work with a lot of co-occurring individuals. We're not a co-occurring facility, but we operate as closely to one as possible. We have outpatient mental health services through White Earth located on site. So individuals are able to, get a diagnostic assessment. We do have the ability to do medication management for mental health medication. We have the ability to do telehealth with psychiatrists, various psychiatric nurse providers, and our nursing staff within our outpatient, and we have nursing staff within our inpatient too that are able to do minor health things. We have a lot of individuals with underlying health conditions, diabetes, chronic health disease, the hepatitis out there. So we do a lot of education. We do a lot of care coordination, getting them set up with, providers in the area. There's not enough hours in the day, sometimes to try to fulfill all the needs, but we do our best, And one of the reasons I wanted to bring Juanita to this conversation too is she's served in various different functions throughout the years. Both her and I have been with Oshki back since, she's been longer than myself, but I started with Oshki back in 2015. And throughout there, we've evolved and, like I said, we're looking to kind of expand on the needs. It's the needs of our relatives we serve that kind of steer us into what we can do.
Would you be able to do that right now if you could? I mean, if you had the patients, do you have enough people or do you need more space?
Space is always an issue. Office space is always an issue. We're actually completing a renovation for our outpatient our outpatient building right now to add more offices. We're looking to expand upon peer support more and looking at bringing in some more nursing. We're recruiting, addiction professionals, nursing staff as well too. It's pretty cutthroat out there for nursing to get nursing staff in right now. Ever since COVID kind of hit. COVID did change kind of the landscape of a lot of things. There was a lot of good things that came out of it. Telehealth is a big thing we take advantage of. It opens up a lot more possibilities to provide for the needs of our individuals.
Did you have something you wanted to add to that?
I do. Your question was focused on medical needs, and Jeremy answered that very well. I also want to add, since we're our model looks at individuals as whole people, not just people with addictions, but people with addictions who have lots of other areas that they could use support in order to create the groundwork for healing. And in that, we have treatment coordinators on campus that do needs assessments to take a look at some of those other areas. What are the gaps in services? What are the gaps in things that I need in order to stabilize? And so we add into their treatment plan some of the things that would help them stabilize, such as getting Social Security cards, identification, looking for employment, looking for housing. So some of those are the things that sometimes keep people from being able to focus well on their recovery, because there's so many other things that are off balance. So we try to help support and create balance.
There's a lot of socioeconomic factors too that, can inhibit somebody's ability to, get well, fulfilling some of their basic needs,
Stability in life is important, isn't it? I mean, a lot of people of us that, we have stable lives generally, places to go home to. Not everyone has that, and that probably makes it more difficult to recover.
Yes, definitely.
What determines if someone's going to be an outpatient, use outpatient services, or be inpatient at the facility? Is it a room question?
There's a couple of things. One is we do something called a comprehensive assessment. And the assessment looks at a person's, the whole person, what they're using, how much they're using, how long they're using, the problems that are associated with using. And there's a scoring criteria that comes out that is actually matched with the DSM-5, okay, for substance use. And outside of that, comes recommendations. And so we look at the person and see how chronic is the illness or how much support the person needs. And the recommendation is the level of care, which is like residential, outpatient, or even withdrawal management. The recommendation comes out of their expressed need during that evaluation period. And so if the person's situation, circumstance, addiction is presenting as very chronic, we may make a recommendation that they go into inpatient treatment in order to stabilize. And so it really depends on the level of care that the person is needing at that point of contact. Another thing that comes into play is client choice. There was a time in this field that the person who does the evaluation, they make the recommendation, and like it or not, you're going to inpatient treatment. This is our recommendation. Now we may say, this is what we believe would benefit you best. And the client will say, yeah, but I'm not going. Yeah, but I have barriers. Yeah, but who's going to take care of my 6 children at home? So it's a combination of what is presenting and what the client is needing at that time.
Mm-hmm. And you said earlier, Jeremy, that there is room at the facility for children to come with people if people have custody of their kids.
That's correct. So right now we have the ability to house 20 women based on our various room sizes, and the guidelines that we follow will be dependent on how many children they can have with them, as well as we do operate a tribally licensed daycare on site. So depending on the availability in our daycare, the physical space that we can allow would be dependent on how many children can come with the mothers. We like to kind of laugh and be happy, because we call them Oshki babies, because we've had individuals with us that, have been pregnant. They've been with us. We've seen births coming back with new babies. Our goal is to keep that reunification with the mothers. And that's always one of the things that puts a smile on my face, is seeing those little ones with their mothers, because the love they have for their mothers. The disproportionate rate of out-of-home placements within the Native American community. We try to put a dent in that, keeping mothers, having those children part of their journey to wellness is a big thing, because there's that, just ultimate love that the family has, and, working. It's hard being a parent, and, whatever we can support, and I mean, it's hard being a parent, especially going through, addiction struggles, So
I want to ask you more about the cultural component there, but first I wanted to ask about Juanita, mandated drug counseling. When a court tells people they have to get counseling, they have to get services to try to beat their addiction. Does that work very well, or do people have to want it?
Excellent question, Todd. Okay, so here's how I've seen it play out over the years. Sometimes that intervention is exactly what is needed. And a person's mandated time out creates the space for a person to take advantage of that opportunity and seek their healing. And some have done that, have watched it play out, never turned back. Others will elope same day of intake, within 5 days of intake, or realize that, all right, I'll just play the system and go ahead and do my time, start counting down the time right away in order to avoid incarceration, but never necessarily take it seriously. So it really depends on the individual. There has been some success with that, and there has been some failures with that. A person ultimately will need to have internal desire to pursue their wellness. Otherwise, it will not work.
Right. Because they probably would have never got addicted in the first place if they didn't find some enjoyment of some kind. I mean, at least at first, right? When they start becoming a drug user. I mean, isn't that why people start? It's a hard one, I know, but because most people want to say, oh no, it's just that you can't help it or whatever. But that's why people drink, that's why they use some kinds of mind-altering drugs, right?
Well, the motivation for using varies from individual to individual. No one as a child wakes up one day and says, when I grow up, I want to be a drug addict. Or a person addicted to substances. There's a lot of other things that happen that can cause a person to go from experimenting or trying drugs, whether that's for peer pressure or for a relief, or because they see that it seems like it benefits someone in some way, to being desperately in need of supportive services in order to arrest their addiction. And those could be things like biological traits, historical trauma, profound childhood trauma, or something people call ACEs, adverse childhood experiences. There's a list of childhood traumas that sometimes can lay that groundwork for someone. Things change in our bodies sometimes when we're using, like chemically. And so let's say, I'm going to use Jeremy because he's at my right elbow. He and I could probably try something, same day, same time, same substance. And for something that he opens something up in me that's different from him. And he can be like, done with that, walk away tomorrow. And I have years of struggle. It all depends on that individual and so many other factors, biologically, economically, socially, that can determine someone's outcomes when it comes to addiction.
So there's no hard and fast, no rules. There's no do this, do that, and then do this, and the problem's fixed.
Exactly. And treatment is going to look different for everyone. What works for someone. Someone might go, well, I quit cold turkey and that worked for me, so what will work for you? And some others might go, I need to go to a group and be around like-minded people who are all pursuing the same thing. And some might say, you know what, all I need, it needs to be me, God, the woods, and a bicycle trail. It's going to look different for everybody.
I think that's one of the things that's kind of a fallacy, is that there is no cure for addiction. Addiction is, it's a disease. It's a chronic disease, and it's something that you're never going to be cured of. You're going to have to, manage it, much like a chronic disease like diabetes or something, And I think that's one of the things, I've seen over my years, is that, there's a lot of different factors as to why people use. Loss of identity, and you mentioned bringing up the cultural component, but that's a big thing, loss of identity, the traumas, I would say a majority of our individuals we serve have some type of, trauma in their life they've experienced that they medicate. It can come down to as simple as I can't quit because I don't want to get sick. Mm-hmm. If you've ever seen somebody in opiate withdrawal, it is not a pretty sight. Mm-hmm. Mm-hmm. And that's the biggest fear that I've seen for somebody who has an opiate use disorder is I don't want to be sick. Mm-hmm. And that was kind of one of our things with implementing our medication for assisted treatment is to help people with that withdrawal, do whatever mitigation we can for those withdrawal systems.
Unfortunately, we just have a few minutes left of our show.
Okay.
But Jeremy, how does the cultural component of what you do at Oshki work? I assume we're talking about Native American culture.
Yes, definitely. So we kind of have the mindset of trying to use culture as treatment. Getting our individuals back to their roots. Myself, I've learned so much over the years, not growing up traditional, but having that stuff come naturally to learn, our various ceremonies, what their means are, our respect for the environment, our just overall kind of family dynamics and things. We try to implement that into our daily life and treatment. We have weekly ceremonies, teachings. We work very closely with the White Earth Behavioral Health Cultural Department. And people getting their Native American names. We offer sweat lodge and things, and just connecting with that spirituality.
Are these kinds of things that these people might not have been familiar with before they came to Oshki Manidoo?
Yeah. And I bring that back to that kind of loss of identity, not knowing who you are, where you came from, what things mean, but to be able to learn, hey, this is a beautiful culture. I can learn these things, it helps healing, healing with self, healing spirit and things.
Right. Does that seem to work for the outpatient people as well?
It does. It is not uncommon to hear people say, I did blank for the first time while I was at Oshki, and really appreciate that cultural thread, the ceremonies that are offered, and incorporating, you can see somebody starting to stress out a little bit, or the energy shift in a space, and someone says, we should smudge. They may have done it 20 minutes ago, but feel like it's time to do it again. So we keep things around so people can grab and incorporate in their daily lives. And if they want medicine to take home, we send medicines home with them. And so a lot of people express the benefit of leaning into their culture as part of the healing.
Well, we're running out of time. How do people find out more about Oshki Manidoo?
So if they visit whiteearth.com, there is a page under our behavioral health division. We're part of White Earth Behavioral Health. They can call us 218-751-6553. That's our main number. That'll connect you to any one of our programs.
Thank you much. Thanks for joining us for Lakeland Currents.